Good morning, everyone, and welcome. I'm Dr. S.K. Singh, and I'm pleased to have you here today. We're going to be talking about sterilization by filtration, which is a crucial process in many industries. This presentation will cover the principles behind filtration sterilization, the methods used, and its applications. So, let's get started and explore this important topic together. Let's start with the definition. Sterilization by filtration is a method used to remove microorganisms from liquids or gases. The key idea here is that the process involves passing these fluids through a sterile filter. It's important to note that this process does not kill the microorganisms. Instead, it physically removes them from the fluid. Now, moving on to the principle behind this method. It relies on size exclusion, which is a type of membrane filtration. Essentially, microorganisms are retained on the surface of the filter because they are too large to pass through the pore sizes. Speaking of pore sizes, there are two common ones to be aware of. A pore size of 0.45 micrometers is generally used for basic filtration purposes. However, for sterilizing grade filtration, the pore size is smaller, around 0.22 micrometers. This smaller size ensures that even the tiniest microorganisms are effectively removed, providing a higher level of sterility. Overall, filtration is a physical barrier technique that plays a crucial role in ensuring the safety and purity of liquids and gases in various applications. Today, I'll be talking about the different types of filters we use in our processes. First, we have membrane filters, which are thin, semi-permeable membranes that allow certain particles to pass through while blocking others. These are great for sterilization and removing very small contaminants. Then, there are depth filters, which are made up of dense, porous materials that trap particles throughout the entire thickness of the filter. They're especially useful for removing larger particulates and protecting downstream equipment. Next, we have cartridge filters, which are modular and easy to replace, making them very versatile for different applications. Moving on to materials, the most common choices include PVDF, or polyvinylidene fluoride, known for its chemical resistance and durability, nylon, which offers excellent strength and biocompatibility, and PTFE, or polytetrafluoroethylene, which is highly resistant to chemicals and heat. Now let's look at the equipment used in filtration. The core component is the filtration assembly, which houses the filter itself. This is connected to filter housing, which holds everything securely in place. To create the necessary flow, we use a pressure source, either a pump or gas, to push the fluid through the filter. In addition to the main filters, pre-filters are often employed to remove larger particles early in the process, extending the life of the main filter. Finally, the sterile receiving vessel collects the filtered fluid, ensuring it remains free from contamination. All these components work together to ensure efficient, reliable filtration, key to maintaining quality and safety in our processes. Now, let's dive into the critical process parameters, or CPPs, that are essential for ensuring the quality and safety of our filtration process. First, pressure plays a vital role because maintaining the correct pressure helps prevent damage to the filter and ensures optimal flow. Speaking of flow, the flow rate is equally important as it impacts the efficiency of filtration and the overall process time. Next, filter pore size needs to be carefully selected to remove unwanted particles while allowing the product to pass through without issues. Temperature is another key factor. Keeping it within the specified range maintains product stability and filter integrity. Product viscosity also influences how easily the liquid passes through the filter, so understanding its properties helps us set the right parameters. Now, regarding the method, pre-filtration might be necessary if the product contains larger particles or debris to protect the main filter and improve overall efficiency. Before starting, a filter integrity check, or a pre-use test, ensures that the filter is properly functioning and free of defects. During filtration, working under aseptic conditions is critical to prevent contamination and maintain product sterility. After filtration, Conducting a post-filtration integrity test confirms that the filter remained intact during the process, giving us confidence in the sterility of the final product. Finally, filling into sterile containers must be performed carefully to maintain the aseptic environment and ensure the product remains uncontaminated through to the end of the process. All these parameters and steps are interconnected and essential to achieve a consistent, safe, and high-quality final product. When we look at regulatory requirements, it's essential to understand the key standards we must comply with. First, there's the EU GMP Annex 1 from 2022, which sets the framework for sterile manufacturing within the European Union. Then, we have the WHO GMP guidelines, which provide international standards for quality assurance. And of course, the FDA guidelines that are applicable, especially for those operating in or exporting to the United States. Now, what are the key expectations these regulations impose? One critical point is the use of a 0.22 micron sterilizing filter. This filter size is crucial because it effectively removes bacteria and other contaminants, ensuring the sterility of our products. Another important aspect is mandatory integrity testing, which should be performed both before and after use. This helps verify that our filters are functioning properly throughout the process, preventing any risk of contamination. Maintaining an aseptic processing environment is also non-negotiable. This means controlling every aspect of the environment to prevent microbial contamination, from cleanroom design to personnel practices. Lastly, many regulations call for the use of redundant filtration, what we often refer to as double filtering. This additional safeguard adds an extra layer of protection, ensuring that if one filter fails, the second can catch any potential contaminants. Overall, these requirements form the backbone of ensuring product safety and quality in sterile manufacturing, aligning with our commitment to regulatory compliance and patient safety. Let's talk about the validation requirements now. Validation includes several key tests to ensure the safety and effectiveness of our filtration process. First, there's the bacterial retention test, which confirms that our filter can effectively remove bacteria, specifically Brevandomonas diminuta, which is a standard challenge organism. Next, we have the extractables and leachables study. This is crucial because it helps us identify any substances that could leach out of the filter materials into the product, ensuring that nothing harmful reaches the end user. Then, there's the compatibility study. This test verifies that the filter materials are compatible with the fluids or products they will contact, preventing any adverse reactions. Finally, we perform integrity testing validation, which is vital to confirm that the filter remains intact and functional throughout its use. Now, the key point here is that the filter must demonstrate the ability to remove Brevandomonas diminuta effectively, as this microorganism is often used as a worst-case challenge in validation. Let's move on to integrity testing methods. We use several approaches to ensure our filters are working properly. The bubble point test measures the pressure at which air bubbles pass through the filter, indicating pore size and integrity. The diffusion test checks whether the filter can prevent certain molecules from passing through, confirming its barrier properties. And the pressure hold test involves applying pressure and monitoring for leaks or failures over time. Together, these methods confirm that the filter is intact, functioning correctly, and ready for use in critical applications. Let's take a closer look at the advantages and disadvantages of this sterilization method. Starting with the advantages, it's particularly suitable for heat-sensitive products, which means it won't cause thermal degradation. This is a huge plus when dealing with fragile materials. It's also fast and efficient, allowing for quick processing times without compromising quality. Plus, it can sterilize final solutions directly, which simplifies the overall process and reduces the risk of contamination later on. Now, on the flip side, there are some disadvantages we should keep in mind. For example, it doesn't always completely remove viruses, especially in certain cases, which could be a concern depending on the application. It's not suitable for suspensions, So if you're working with particulate matter suspended in liquids, this method might not be the best choice. There's also a risk of filter blockage, which can disrupt the process and require additional maintenance. Lastly, it requires strict aseptic handling, meaning that careful procedures must be followed to avoid contamination, adding a layer of complexity. Overall, understanding these pros and cons helps us decide when this method is the right fit within our broader sterilization strategies. Now, let's take a look at some of the key applications for this substance. It is widely used in injectable solutions, which means it plays a crucial role in delivering medications directly into the bloodstream or tissues. It's also important in ophthalmic preparations, where precision and safety are paramount to treat eye conditions effectively. Additionally, you'll find it in vaccines, helping to preserve the integrity and effectiveness of the immunizations we rely on. Lastly, it's used in culture media, particularly for heat-sensitive organisms, providing an optimal environment for growing various microbes in laboratory settings. Recognizing these applications highlights how versatile and essential this compound is across different fields of medicine and research. All right, let's walk through this example calculation. We start with a volume of 1,000 milliliters, which is the total amount of fluid we're working with. The time given is 10 minutes. To find the flow rate, we simply divide the volume by the time, so 1,000 divided by 10. And that gives us 100 milliliters per minute. This calculation is important because it helps us ensure that the filtration process is happening at the right rate. If the flow is too fast, we might damage the filter, which can compromise the entire process. On the other hand, if it's too slow, it could delay our workflow. So always remember, the flow rate needs to stay within validated limits. Those are the parameters established through testing to guarantee safety and efficacy. Keeping this balance ensures proper filtration without risking damage. And that's the key takeaway here. By calculating and monitoring flow rates carefully, we maintain both product quality and equipment integrity. In conclusion, the importance of filtration in pharmaceutical manufacturing cannot be overstated, especially when it comes to heat-sensitive products. These products require careful handling to maintain their integrity and efficacy, which is why using validated filters is absolutely crucial. Validated filters ensure that we are consistently removing contaminants without compromising the product's quality. Moreover, maintaining strict aseptic conditions throughout the process is essential to prevent any microbial contamination. This isn't just a best practice, it's a requirement to safeguard patient safety and comply with regulatory standards. And finally, integrity testing plays a vital role in this entire process. It provides us with the confidence that the filters are functioning properly and that the sterility of the product is preserved. Without thorough integrity testing, even the most well-designed filtration process could leave room for risk. So, in essence, effective filtration, validated filters, strict aseptic protocols, and rigorous integrity testing all work together to ensure that heat-sensitive pharmaceuticals are safe, effective, and of the highest quality. For further support, please contact us. We're here to help you with any questions or additional information you might need. Don't hesitate to reach out. Your success is important to us. And with that, I want to sincerely thank you for your time and attention today.